Welcome to the September 15th, 2020 Research Matters. We're excited to have everybody here. This is Joshua Fedwa, the Associate Director of the HRPP here at UT Southwestern. We're going to be talking about conducting research with COVID-19, navigating the approval processes, and we'll get back to why we're talking about that in just a second. Just some quick housekeeping items related to Microsoft Teams live events. Remember that as an attendee, you cannot unmute yourself or you share your video. So the only way that you can interact with us is by using the Q&A function. There's staff from the HRPP office who are monitoring all the questions as they're submitted, and they'll answer those questions accordingly or bring them up for me to address if it's related to the presentation. The slides and handouts will be sent after this session via the listserv. If you're not on the listserv, we would encourage you to go to our website and sign up for the listserv. A video of this session will also be uploaded to the HRPP Research Matters webpage when closed captioning has been completed. And lastly, attendance certificates will be sent to those who logged in from a valid email address. And what that means is that you've signed in and you've joined through Microsoft Teams. If you joined in any other manner, you're going to join anonymously, and we won't know that you attended. If you do need to receive a certificate and you joined anonymously, email hrpp@utsouthwestern.edu and we'll get you a certificate as soon as we can. So what we're going to be talking about today, metrics, some announcements, and conducting research with COVID-19. And I just wanted to go back, like I said, and just address that this is slightly different from the schedule that is on our Research Matters webpage. The reason that we're bringing up the conducting research with COVID-19 is that during the August focus group, there were a lot of questions about the different approvals that were in place or being required for any study that was conducted with COVID-19 or on COVID-19. And we felt that it was important for us to address those questions and outline a framework for everybody on what sorts of approvals were required for these studies. The website will be updated, and Rhonda will be giving the state of the HRPP in October, and the rest of the presentations will be bumped back a month as appropriate. So moving on, we have our metrics. So this is, again, the total items submitted for new studies, continuing reviews, modifications, and reportable events, broken down over the last 6 months and the last 30 days. I did want to note that in the last 30 days, there was a slight drop in overall total submissions, and this is sort of a trend that we see over July and June. I think it reflects some time off and sort of dog days of summer, but just like normal in past years, we expect to see the workload start to increase a little bit as everybody comes back to work from whatever sort of summer vacation you might have been able to enjoy during this pandemic. Here is the turnaround time for full board new studies. And I want to just note, because we've gotten some questions about what this number means, that the turnaround time here in calendar days includes both the time that it takes to submit, or from the submission date to getting the study to a convened IRB meeting, and also resolving any stipulations that the full board put in place with their approval. The stipulation time includes the study team response time and the time that it takes for the HRPP staff to resolve those stipulations. So some of the variability here in the numbers is really just due to an increase in stipulations. We don't see a ton of full board studies. It's not like we're talking about hundreds. And when you're thinking about median and how much variability can be introduced by 1 or 2 really high numbers with a small amount of samples in a data set, medians can fluctuate more wildly. And that's why we're seeing a jump here. We had some stipulations that were outstanding for longer than we were seeing in June and July, and that's why we saw the increase. Similarly, the variability here on expedited new studies is also due just because of the low number of expedited submissions we receive. Ever since the new common rule went into effect in January of 2019, and the new exempt category, specifically the category allowing chart reviews, that being both retrospectively and prospectively, and including identifiable data, the number of expedited submissions has really dropped in the last 2 years or a year and a half. So because of that, again, we're using medians for our measure here, and with a relatively low count of items going into that calculation, a handful of expedited studies that took longer can change that turnaround time pretty drastically. So we're happy to see that we jumped back down to our goal of 21 overall days. And our analysts and IRB staff know that making sure that we prioritize these expedited new studies is something that they're taking a look at as soon as they're received in their queues. With exempt new studies, it seems that we've sort of hit the sweet spot in terms of reviewing these. From April to August, we've remained fairly consistent in the mid-teens. Very happy to see that, and happy to, because I think this reflects that we're getting high quality submissions as well as having an effective and quick turnaround time within the office. And lastly, Reliance new studies, and the same sort of variability disclaimer applies here as we applied, or as I applied to the full board and expedited new studies. With a small handful of studies, you know, 1 or 2 submissions going above the rest of the numbers can vary that number up higher much more easily. So we have seen an increase in Reliance submissions, but still relatively smaller compared to some of the other groups. Here are the major modifications, and I want to note that in just a couple of slides, I'm going to touch on the submission schedule for convened IRB submissions. With major modifications, we started seeing a trend earlier this year that the analyst team was requesting, either through Eric or through Chuck, to move submissions up earlier in the review cycle. And what that meant is that the modifications were coming in with a higher quality submission. There was quicker pre-review response times. And so they were ready to be reviewed by the convened IRB well in advance of the expected assignment when we received it. So we've actually started assigning full board modifications earlier than our submission schedule would indicate. I believe that Chuck is currently assigning major modifications to agendas 21 days out from submission rather than 30 days out from submission. And we're happy to see that we continue to stick right around that 20-day mark. And I anticipate that our goal might actually change on this. It's really important that we make these major modifications a priority within our office. Often these major modifications are accompanied with increases in risks and highly important information for our research participants to hear timely. And it's good to see that we're making sure that these are reviewed as quickly as possible. And lastly, here are the minor modifications. We're seeing a trend where we stay underneath our goal of 10 days. And we've even dropped down to 4 days. I'm not sure entirely what the reason for the drop here is from July to August, but I'm happy to see it, and I hope to see that we stay well under our goal of 10 calendar days as we move into September and our new fiscal year. Some announcements. So I just wanted to remind everybody of the HRPP and OCTM virtual office hours. This debuted on May 5th and will continue until further notice via Zoom. Our virtual office hours are being held every Tuesday and Thursday from 10 to 11 a.m. And for those of you who were present or UT Southwestern or one of our affiliates. This is a change from the prior office hour schedule where we were holding them twice a month. This is now closer to 8 times a month, and Eric could correct me if I'm wrong on that schedule, but we are definitely seeing some increase in this or some interest in this, and we're happy to provide support as much as possible to the research community. The HRPP and Office of Clinical Trial Management staff are available to help with questions. The Zoom meeting links are being sent out via the events listserv. It's important for those of you who don't remember, we did set up a new listserv last year, the events listserv. So there's the news listserv, there's the events listserv. The events listserv includes the Research Matters invitations, these virtual office hours invitations, the only way to get the Zoom meeting link for these virtual office hours is through the events listserv. Just because of security concerns with Zoom meeting links, reusing them or having any sort of Zoom bombing, we are creating unique meetings for every virtual office hours to make sure that these meetings remain confidential and private. You may think that this was a thing of the past, but I just saw some news this morning that there was a federal government meeting that was interrupted by very inappropriate behavior. So we're going to continue this practice to make sure that these meetings are not interrupted. If you have any questions, contact Eric Solis. And again, I just want to remind everybody, we said this during the last office or Research Matters, everybody in the HRPP and OCTM are largely still working remotely, and we still get some emails to the HRPP mailbox or individually to some of the leadership that people are trying to call the office. They're not getting any responses. We have asked all of the HRPP staff to update their voicemails to make sure that it's clear that we're working remotely. The HRPP staff will be getting their voicemails via an email and should be able to respond quickly. But the office hours, these virtual office hours, are a quick way to get in contact with the HRPP or OCTM to get answers to your questions. Some staffing updates. So we're very excited to welcome back Razija Nambiar. You may, if you've been here at UT Southwestern, we're very excited to welcome her back. She left, I believe, in 2019 and indicated interest in coming back. And so she's joined us on September 8th as a senior regulatory associate. She's going to be working with Eriko Iwatate, who you hopefully remember presented not too long ago on clinicaltrials.gov support, and both Eriko and Razija will be helping to support study teams here at UT Southwestern and our affiliates in registering studies and maintaining accurate records in clinicaltrials.gov. And I believe there's more information to come on what Eriko and Razija will be supporting. We're also excited to welcome to our team Jasmine Nobles, who joined just yesterday as our regulatory assistant. Unfortunately, Zara Lally left us earlier this summer. She moved on to a new position that we were excited to have her move on to, but we're happy to have Jasmine come on and help out the HRPP and keeping us afloat. And then just an update for Scott Myers, who is formerly of the IRB team. He will be moving to the quality and monitoring team as a regulatory monitoring analyst. For any of you who might have talked to Scott and gotten some of the background, he came from the Boston area, and his passion as it relates to research is really in monitoring and post-approval monitoring, post-approval assessments, those sorts of things. So we're excited that he's going to be able to leverage his passion and his expertise working with the quality and monitoring team. The senior regulatory analyst position that Scott currently is in will be posted soon, available on our website. And if you have any questions or would like to indicate interest in addition to applying for the position, feel free to email Rhonda and or Eric Solis. That senior regulatory analyst position will be reporting up through Eric. We also have some website updates. So the fiscal year 21 IRB meeting schedule was uploaded to the IRB website. It was specifically uploaded to the IRB web pages, the UT Southwestern IRB web pages. It's important that we bring this up right now because recently eIRB was updated to hide the internal routing of studies. We received significant comments, questions, complaints about just the way that we standardly review and approve submissions and how we route those studies throughout the HRPP. Just because that's really sort of internal practices, we asked that those activities be hidden. For those of you who relied on looking at that history and seeing after your submission when your new full board study or major modification was assigned to a convened IRB meeting, you can still go and find what the assignment is going to look like. On the FY21 IRB meeting schedule, this is a snapshot of the information. If you had submitted your full board new study or major modification or a continuing review that requires full board review as of yesterday, then that will be reviewed on or before October 14th, pending any outstanding issues. I just want to note that the HRPP staff must receive approval from leadership within the office to push a submission back from the assigned and expected meeting. So you can rely on this meeting schedule to determine when your submission is going to be reviewed. There's also two more updates. These updates are not live yet. I'm still waiting on our web services partners to approve these changes, but they will be available soon. So a Karen short form, yes, that is a real language. I believe it's a language spoken in Myanmar. We had a research participant present who spoke Karen within UT Southwestern. We were happy to be able to support getting that translation completed and put that short form and the certificate up onto the forms page. If you do have any participants, prospective participants who may speak Karen or a language similar to Karen, please feel free to use that document, assuming that you've gotten IRB approval to use short forms. And then we've also updated the policy and guidance web page with some guidance documents that were formerly on the web page under the news section, but just because they were somewhat old, the news cycled off, and so we've added them to the policies and guidance document web page. This is just two examples. There's more documents that are on that web page. The first one is enrolling and consenting non-English speaking subjects. Very important if you have not read that or have not read that in some time to remind yourself what the IRB will be doing as it relates to use of short forms and how to consent participants on a long form or a short form. And also our guidance on the IRB review of pregnant partners. Just want to remind our research community that we do not consider pregnant partners or children born of pregnant partners to be research participants unless those documents are submitted to us. So please use this document, provide it to your sponsors or to your external collaborators, and let them know that we do not consider pregnant partners to be research subjects. But if you submit those documents to us, we will require a consent form, a recruitment consent plan, and our Form O for pregnant participants and pregnant partners to be completed. So moving on to conducting research with COVID-19. So why do we have additional approvals for studies researching COVID-19? We have a couple different reasons, and this is certainly not an exhaustive list, but just a couple of the reasons that we can highlight during this conversation. The first is really to reduce burden on research participants. COVID-19 is a novel virus, a novel infection of the human body. And so there is obviously a lot of research interest, a lot of questions that need to be answered in order for us to effectively manage and treat this disease. But just because there's a lot of interest, we want to make sure that as patients are presenting to our hospitals, as communities are being asked to consider research studies about COVID within the community or the effects of COVID on communities, that we're not asking research participants, prospective participants, to consent to a lot of different studies. We have to remember that to get a COVID diagnosis is can be traumatic, can be scary. It can be a situation where people just don't feel like they can necessarily understand what's happening with them. So we need to make sure that we're not asking these patients and community participants to consent to a lot of different research studies. We want to make sure that we're asking them to consent to participate or to research studies that are truly pertinent to them and answer important research questions. We also want to make sure that we're keeping the burden on hospital resources and staff to a minimum. I don't think that we have to go back too far to remember when there was a significant concern that hospital staff, and it may still be a concern, that there may not be enough protective equipment, personal protective equipment, and or staff to truly treat not just COVID participants or COVID patients, but also anybody who may need to come to the hospital or our clinics for some sort of treatment. We need to make sure that these studies being conducted as an institution truly are answering important questions, and if they're asking for some sort of resource or staff involvement, that's carefully considered. And then the last example, but certainly, like I said, not the least, we need to make sure that we're making best use of valuable and limited specimens. At some point, we hope that COVID-19 will be just like the flu, or I'm trying to remember the viruses from 2009, H1N1. We hope that that's what's going to happen. And what that means is that there's potentially a finite amount of time when we're going to be able to conduct this research and get specimens from COVID-19 positive patients. So we need to make sure that any research that we're conducting considers what the best use of those specimens is. It's also important to note that these approvals may not apply to all COVID-19 research. And it may not be the only applicable approval that you have to obtain, especially if you're at an affiliate institution. So you need to make sure that you're touching base with your own research administration and understanding what their processes may be in addition to these approvals that we're going to go over for UT Southwestern conducted studies. And it's also important to note that the decision tree that I'm going to show in just a couple of slides is not necessarily a black and white decision tree. There's definitely going to be gray areas as it relates to looking at these studies and determining what the appropriate approval process is. And that's going to be on a study-by-study basis. We hope that this decision tree is a good one-size-fits-all, but obviously for anybody who has maybe tried something on that's one-size-fits-all, it truly is not one-size-fits-all. So just please be understanding that as you submit a new study in the future, there may be some additional requests or something that deviates from what we're talking about today. Like I just said, I just want to reiterate that the additional approvals that we're going to go over in just a couple of slides do not alter existing requirements, including IRB review and approval, performance site review and approval, requirements for coverage analysis, clinical trial agreements, or ancillary committees like the Protocol Review and Monitoring Committee within our Cancer Center, the Radiation Subcommittee within our Radiation Safety Program, the Institutional Biosafety Committee, and that is not an exhaustive list either. But that does prompt me just to remind the entire research community that all studies submitted to the IRB that will collect, store, handle, analyze, or use in any fashion a biological sample containing or suspected to contain COVID-19 must be registered with the IBC. And we use that word very specifically, registered, with the IBC. If you have questions about what that means, I would encourage you to contact Patrick Conley, Maria Labanderi-Ray, or Carlos Vaccaro. It's important to note that there's a difference between IBC approval and IBC registration. I am not an expert on IBC, but I just want to lay that out there. And if you have questions, you can contact one of those three people. Ensure that you select the appropriate option in EIRB question 6.7. And that looks like this. That includes this infectious agents, biological toxins, recombinant DNA. And just to note, the COVID-19 would fall under that infectious agents. It's important for IBC to review these studies because we're talking about a novel virus. And depending on how that sample is being handled by the research study team, if it's a team that has no knowledge of how to handle an infectious agent, or is going to be doing tests in a room that is not set up to handle those sorts of tests, the IBC support staff, Patrick, Maria, and Carlos, can help guide you on the appropriate processes in place to protect staff and participants. When you're submitting a new study in EIRB, IBC is a blocking review. Your study, after it is approved by the department chair of the investigator, will automatically go into a queue waiting for the IBC to approve it. So it's highly encouraged to start any submission with the IBC as soon as possible. They have a separate system that they consider and review and approve studies under. So you do not have to wait for EIRB to notify IBC. You can also talk to them as soon as you're aware that a study might be coming up. Just also another note, studies involving only some sort of data analysis will not see question 6.7, but that does not mean that IBC registration is not required. If you are conducting, just like I said on the slide before, any sort of analysis with a sample that is suspected to contain or does contain COVID-19, you must register that study with the IBC. So just because the EIRB system may not prompt you to do that, you still must do that, and that will be something that the HRPP staff confirm during the review of the study. So, as promised, here is our decision tree for COVID-19 research. I do understand that this is small text and it's not necessarily the easiest to read. We have a PDF of this that we will share after the presentation in the email with the slide deck. And in the slides that we're going to be bringing up in just a second, I've also pulled out each of the different decision points and how it relates to that particular process. So you will see some of these shapes appearing in the slides as they're coming up. So the first question that we're really asking with these COVID-19 studies is, are we studying the effects of the disease itself or of the pandemic and the associated things with the pandemic, whether that's mask wearing, some sort of closure, some sort of social distancing guideline? So we're really asking that question. Are we looking at the effects of COVID-19 and the disease itself or the pandemic? And just to highlight and sort of drive this home, I have some examples of effects of COVID-19 and samples of studying the effect of the pandemic. So we could be looking at treatments for the infection, the mechanisms of infection, or some sort of effect of COVID-19 on a disease or condition that we may have in the community. For example, what is the effect of COVID-19 on patients with sickle cell disease? That might be a study that could be proposed and ongoing. When we're talking about the effects of the pandemic, we could be talking about the effects of the pandemic on socialization of young children. This is certainly a question that I'm sure every parent has asked as their child is at home and not going to daycare or not going to maybe in-person school the same way that they had it, not playing with their friends in the same ways. What's the impact of the pandemic on how children are being socialized to human norms? Is the pandemic causing patients to avoid healthcare visits? I know that as I've listened to the news, I've certainly heard this talked about. Are people avoiding the dentist? Are people avoiding the emergency room? Are people harming themselves because they're afraid to leave the house when they have a valid reason to do so based on something to do with their healthcare? I actually just did a quick Google search yesterday and found that there was a study being done, published, and I believe that I found this study in PubMed, the effects of the pandemic on productivity and costs for employers. Certainly I think this is a valid question and something on what does remote work mean? What does the cost model look like? And what are the effects of costs for employees working at home? I know myself, I have saved a lot of money on gas, and I would be happy to participate in any sort of study where I could say, I like not having to fill my car up that much with gas. So if you're doing a research study looking at the effects of the pandemic, then you're not going to need any more approvals. And that's really displayed here in what's here in the shapes. If you're studying the effects of the pandemic, then you can go ahead and submit that project for review. And you'll notice that that submit project for review is somewhat vague. I didn't say submit the study to the IRB for review. I didn't necessarily specify who you might submit that project to, because there could be studies looking at the effect of the pandemic or the effect of COVID-19 that may not need true IRB review. It may be quality improvements, it may be quality assurance, it might be public health surveillance. And so those things may come to the HRPP here at UT Southwestern. You may be also able to run those things through your own administration if you're at an affiliate site and they're able to determine that the study does not meet research regulations and the definitions of human subjects research. So the next question that we're going to be looking at is studies researching treatments or interventions, and just some quick examples that you can see in the media. Studies looking at the effect of remdesivir on COVID-19, studies looking at the effect of dexamethasone, a steroid, on COVID-19, and there's a lot more that you could easily find out there in the news. Or is the study some externally funded, meaning that it's being funded by the NIH, it's being funded by an industry sponsor, or it's a collaborative study, meaning that the UT Southwestern or local affiliate PI has been approached to participate in a study that is being conducted and run out of another center from across the country. This could be things like external registries or repositories. And so from the decision tree, this is really two decision points. Is the study investigating treatments? Coming back to this particular question here. And if it's not, is the study externally funded or a collaborative study? So if either of these is yes, then you are going to submit your study to Dr. Rowland. She has set up an ad hoc committee reviewing the studies that fit into these categories. Again, like I said, the decision tree is not necessarily truly black and white. If the study is an external registry or repository, it may go through some of the approvals that we're going to talk about in just a second. But the decision from this ad hoc committee will be communicated to the PI and to HRPP leadership. So ultimately, if the HRPP leadership hear from this ad hoc committee that a study will not proceed, then we will work with that PI to withdraw any EIRB submission or close out a non-regulated or non-human request. The next question that we're going to be looking at from the decision tree is, will the study collect or study COVID-19 specimens? And this is going to be any study collecting or studying samples with COVID-19. So earlier this summer and really this spring, UT Southwestern leadership, working with our affiliates from Children's and Parkland, set up a biorepository called the SARS-CoV-2 biorepository. And this biorepository is a collaborative effort between all three institutions. It's collecting de-identified leftover samples and identifiable blood and blood products, sputum, stool, and urine specimens, and clinical data from any participant who gives consent. And this repository is only going to contain COVID-19 positive patients. So this is unique in that we're not necessarily collecting suspected. It is, we know that there is a COVID-19 positive infection here. In order to run this biorepository, a biorepository stewardship committee was set up that's overseeing the safety and oversight of these samples. Again, going back to that first question of why are there additional approvals in place for COVID-19 studies, this is the COVID-19 positive patient specimens are a finite resource. At some point, again, we hope that these resources will dwindle as the infection dwindles within the community. And so because of that, this biorepository stewardship committee is making sure that the samples collected within this biorepository are going to research studies that are answering really important and pertinent research questions. It's also worth noting that any study that may not be receiving samples from the biorepository or putting samples into the repository, but are collecting or studying samples, may also run through this biorepository stewardship committee, because it gets back to that first reason of the approvals. We want to make sure that we're not approaching patients at Children's, UT Southwestern, or Parkland for multiple biorepositories if we can avoid it as much as possible. So there may be instances where you may not intend on getting information from the biorepository. You just want to collect information for an external repository, but we may route that collection through the SARS-CoV-2 biorepository here at UT Southwestern, Children's, and Parkland. In order to get access to any samples or data from this biorepository, your investigator who's proposed this study should create and submit a one-page letter of intent to the email you see here. If that one-page letter of intent is favorably seen by the Biorepository Stewardship Committee, they will invite a full application. So a full application is not going to be possible until the Stewardship Committee asks the investigator to complete that. And the last question that we're answering from the decision tree is the study collecting or studying COVID-19 data from the medical record? And you can see that here, will the study collect or study COVID-19 data? And between UT Southwestern, Parkland, Children's Health, and Texas Health Resources, the COVID Registry Collaborative, what you're seeing here in the title of the slide, it's a collaborative effort, and it's a clinical database. So it is not a research database, it is a clinical database of any person being treated by one of these four institutions with suspected or confirmed COVID-19. In order to see some really amazing graphics and sort of the information that is going into this clinical registry, you can go to the website that you're seeing here. When you see it on the decision tree, it's a clickable link. This does require UT Southwestern credentials, so you'll have to make sure that whoever's looking at this has access to that. But there is a review committee, the CRC review committee, that will be reviewing and prioritizing any data requests. And the way to get access to any samples or data from the CRC, the COVID Registry Collaborative, you send a online application. Again, this online application does require UT Southwestern credentials. So if you need help with that, please contact either the HRPP or Dr. Rollins. Either of us would be happy to help out with that. So just some additional information about this COVID Registry Collaborative. The review committee will issue an approval, and a notification when that approval is issued is automatically generated and sent to the HRPP inbox. If there was a protocol submitted to the CRC review committee, that protocol will be attached to the approval. We will confirm when we receive any study that's looking at collected COVID-19 data that we've seen a CRC approval. If we have not seen that, then we will recommend that the PI go and get CRC approval. When we also see the approval, if an approval is in place, we will confirm that any data requests of the CRC matches what's in the IRB application. So if you filled out an IRB submission within the past 2 years and you included some sort of data collection, the HRPP staff most likely asked you for a data collection tool, some sort of Excel spreadsheet, or a definition of all the different data points that would be collected by the study. When you submit your EIRB application, you'll want to make sure that you include a data request in that IRB application that matches exactly what was requested of the CRC. If the HRPP staff see that there's a difference between the two, then they will require some sort of modification. That may mean that you have to go back to the COVID Registry Collaborative Review Committee to get a new approval for the additional data that you did not initially include. So that's everything as it relates to the COVID approvals. Again, I just want to reiterate that this is not going to be a black and white process. There will be some gray, and we will look forward to working with you and any faculty or investigators to answer some of these questions. I'm just going to jump over and take a quick look at the questions. So I see that there's one question: who does the IBC require when it comes to protocol amendments, notification, re-review? Just to answer that question, what will the IBC require when it comes to a protocol amendment? You'll want to touch base with Patrick Conley, Maria Labandere-Ray, or Carlos Vaccaro to determine what would the appropriate process be if you have a study that was reviewed initially by the IBC and now that you're making revisions to. So I see there's another question. If you have a clinical trial for COVID, should you first go to Dr. Rollins, that ad hoc committee first, and then go to the SARS-CoV-2 biorepository for review before submitting it to the IRB in addition to the IBC registration? I would recommend starting with Dr. Rollins to confirm that the study will be allowed to proceed. Once you know that the study will be allowed to proceed, you can proceed with submitting to the IRB and getting the study registered with the IBC. I believe that if the study requires review from the SARS-CoV-2 Biorepository Oversight Committee, the Stewardship Committee, I should say, then Dr. Rollins or another member from that ad hoc committee will initiate that review themselves. And then the last question that I'm seeing here is the COVID registry study approval would not be needed for an industry-sponsored study where samples are being sent out. That will, most likely the CRC approval would not be needed. That study would have been caught by the first question in the decision tree that it would go through Dr. Rollins's ad hoc committee. There's also another question: is there a COVID-19 registry at Children's only? That I do not know. If you need an answer to that question, you'd want to check with Children's Research Administration to determine if they have a registry that is only including children's patients and or data. And then I'm seeing just another question, and this is a good one. I'm not sure if Allison Beaver submitted this, but I suspect it might have been Allison Beaver. This is a good reminder that any study restarting must be reviewed by the Office of Clinical Research. So this was something that we included in the May Research Matters when we talked about reopening research studies and restarting in-person research visits. All study restarts must be reviewed by the Office of Clinical Research, and that according to this comment for both Parkland studies and UT Southwestern. for new studies and those that may be halted. If you have any questions or comments, reach out to Allison Beaver for those comments or questions. So there's another question here. What if you're proposing to extract data from the EHR, the electronic health record on COVID, but you don't want to get data from the registry? Is the COVID registry approval needed? It's possible that the study may still be routed through them simply because from a resource perspective, if they are already collecting the data, then it'll be much simpler for them to extract the data and get it to you. That'll make it quick and easy. It'll also depend on how you're proposing to extract that data from the medical record. If you're proposing on going into the medical records and extracting those yourself, then it may not be required. But if you're asking any sort of extraction from information resources, then they will route you through that COVID registry because there is a significant demand when those requests come in, and that's why that clinical registry was set up. I believe that is all the questions that have come in that have not been responded to. Am I missing anything? Anybody else, any other HRPP staff?
Hi, Josh. We have one question. It's possibly being answered, but what if Dr. Rollins is not aware of the study? Do you still have to go through her?
If the study falls into either a treatment study or some sort of external collaboration or externally funded study, you will want to make sure that Dr. Rollins is aware of this study and that ad hoc committee is has approved it. Now, if it's an already approved study, the IRB has already approved it, you can assume that we have confirmed with Dr. Rollins and the ad hoc committee that the study was allowed to proceed.
Josh?
Yes.
That question was reworded, and it's what if Dr. Rollins is already aware of the study, the COVID study? Do they still have to go through her?
If Dr. Rollins is, thank you, Eric. If Dr. Rollins is already aware of the study, then she, I believe, will make sure that that ad hoc approval is going to be in place before she lets the HRPP staff know to proceed with reviewing the study. Okay, well, just give it a couple seconds just to confirm that there's no more new questions. If you do have any questions or comments, please reach out to us. And as we indicated at the top of the slide deck, the copy of the slides and the decision tree handout will be sent to everybody via the listserv. Thank you, everybody, for attending, and we look forward to seeing you in October as Rhonda presents on the states of the HRPP. Stay safe and have a great day.